Welcome to Special Needs Powerless Faith and Action. For without action, then our faith is dead. My name is Eva, just in case you're new here, and in today's video, we're going to talk about Down syndrome, a genetic disorder. Please click on the subscribe button and click on the notification bell for you to be notified any other time a new video is coming out. Please stay tuned and watch this video up to the end. During baby formation, parents pass their genes to their children, whereby half of the genes come from the mom and half of the genes come from the dad. So when the fetus starts to develop or the fetus starts to grow, there is cell division. And during the process of cell division, each cell is supposed to receive 23 chromosomes. That is a total of 46 because of 23 from the mom and 23 from the dad. So what happens in Down syndrome is that there is an extra production of a chromosome. That is, the chromosome might not separate well, and therefore leading to an extra copy of production of that chromosome. That is chromosome 21. So therefore they end up having 3 copies instead of 2 copies. And production of that extra chromosome leads to problems in brain and even in physical development. And that extra chromosome is what leads to Down syndrome. And because this is a problem that starts when the child is still in the womb, screening can be done, or rather diagnosis can be done, and can show that this child can develop Down syndrome when they are yet to be born. Although the effects cannot be predicted. The effects of Down syndrome cannot yet be predicted when the child, or rather the children, are still in the womb, but you can notice or you can know when your child can develop Down syndrome because there are certain tests that can be carried out while pregnant so that you can know this child could develop Down syndrome. Diagnosis can be done during pregnancy because there are certain blood tests that can be done, or even removal of some fluids from the placenta and even using the amniotic fluid, and this can help one know if this child could develop Down syndrome. What are some of the symptoms of Down syndrome? What can show you that possibly this child could be having Down syndrome? Although a disclaimer, you are not supposed to assume anyone got any condition without medical diagnosis. Symptom number 1 is flattened face. You find that this individual's face could be flattened. So after the flattened face, you can also notice that these individuals have short neck. Their neck is short and their head is also small. So the face is flattened, the head is small, and the neck is also short. Another symptom is also that these individuals have excessive flexibility. They are so flexible. They can do any exercise without any problem, and most of the time you also find that their sitting position, they prefer to put their legs crossed. They prefer to sit on the floor and their legs are closed. So they are so flexible. Any kind of movement they can just do without any problem. Even sometimes they can carry their leg and put it on their head and they are rolling around. They are just performing things like gymnastics that they are not even trained of, or no one else can even do them. So they are so flexible and they can just do things, muscle movements, so easily without any problem. Another symptom also is that their feet, their fingers and their hands are relatively short when you compare to their peers. And because of short feet, short hands, short fingers, and also short toes, you also find that their height is also short when you compare to their peers. They are not as tall as their peers. There is that shortness of just being short, but then there is extra kind of shortness, or it's relatively low shortness. When you compare to their peers, you can find that they are a bit low. You can even think that they are of a lower age or a younger age, let's say, but in real sense they could be even older than the person you're comparing them to. Another symptom also is that they have a protruding tongue. Their tongue is a bit longer and they can take it out of their mouth and even put it above the nose. So their tongue is relatively long and protruding. And the last symptom is that they have poor muscle tone. You find that their body is flexible, yes, but their muscle tone is so poor. They are not so well toned. However, every individual with Down syndrome is very different from the other individual, because Down syndrome ranges from mild, moderate to severe. So you cannot keep comparing one individual with Down syndrome to the other, because their strengths and their possibilities and what they can do is very different from each other. And on that note, thank you very much for watching this video. See you next time in the next video. Don't forget to subscribe and click on the notification bell.